Why does urethra obstruction lead to overflow incontinence? Imagine trying to pour water through a narrow pipe. If the pipe is blocked or too tight, the water backs up. That's similar to what happens when the urethra, the tube that carries urine out of the bladder, gets obstructed. This blockage can be caused by an enlarged prostate, strictures, tumors, or other issues. When the urethra is narrowed or blocked, urine can't flow out normally. Instead, it starts to build up in the bladder, which is like a balloon filling with water. As urine accumulates, the bladder stretches and becomes overly full. The muscles in the bladder will try to contract to push the urine out, but the obstruction prevents complete emptying. This causes the pressure inside the bladder to rise. When the pressure gets high enough, it can force small amounts of urine to leak out around the blockage. This involuntary leakage is called overflow incontinence. It's like a full water balloon that leaks because it's too full and the pressure pushes water out through any weak spot. The main reason for overflow incontinence in this situation is that the bladder cannot empty properly due to the obstruction. The urine stays in the bladder, causing it to become distended and overfilled. Over time, this high pressure can weaken the bladder muscles and the sphincter muscles that normally hold urine in. When the sphincter can't keep the urine contained under high pressure, leakage occurs even if the person is not aware of it. This type of incontinence is common in conditions like benign prostatic hyperplasia, where the prostate enlarges and blocks the urethra, or in cases of strictures or tumors that compress or narrow the urethra. If untreated, the chronic retention of urine can damage the bladder and kidneys, and increase the risk of urinary tract infections. From a bladder health perspective, urethral obstruction turns the bladder into a reservoir that's under constant high pressure instead of a well-functioning pump. This can lead to complications like infections, bladder muscle damage, or even kidney problems. In cases of bladder cancer, tumors blocking the urethra can cause similar issues by physically preventing urine from leaving the bladder. Treating urethral obstruction usually involves relieving the blockage through procedures like surgery, catheterization, or other methods depending on the cause. The goal is to restore normal urine flow and prevent long-term damage. In summary, urethra obstruction causes urine to back up and overfill the bladder, which increases pressure until urine leaks involuntarily. This happens because the bladder cannot empty properly and the sphincter muscles can't hold back the urine under high pressure. It's important to seek medical help to address the underlying cause and protect bladder and kidney health.